So, as you can tell by the title of the video, we're going to talk a little bit about the surgery that I'm going to need going forward. So, I've told this story 4 times already today, and I had planned on doing a video of this. So, I just want to say, if I've sent you this video, it's not because I don't want to talk to you in person. It's just I'm in IT and computers automate things, so it's easier to just throw this out here. I made this for work, and so one of the people at work asked me how everything went yesterday, and I said, what's going to happen with the surgery, and I said, we should probably assemble the Avengers tomorrow and discuss all this. So this is Marvel themed because of that. So I thought it was fun, and yeah. So what I did with this video, because some of you don't know the whole story from, when I was young. So I'm going to start from the whole story from when I was young and what happened and where we are today and what comes next. So that's going to be kind of an all-encompassing video. And again, like I said, if I sent you this, I don't mean to just push you away. It's just, I tell the story a lot. So if you have questions, absolutely reach out. You can leave them in the comments below, or if you've got my email address or my phone number, call me, text me, email me, whatever. I am not afraid to answer questions if you've got them. So, yeah. And if you're someone that found this online and don't know who I am, and you have questions about what I'm going through, or if it's long after this has happened and you want to ask questions about it, feel free to ask questions. Part of why I want to document some of this is to help people going through this. So let's jump right in to what's going on. So for those that don't know, when I was born with what's called ventricular septal defect. And what that is a hole in the wall that separates the right and the left ventricle. So this arrow right here, let me get here, sorry. This arrow right here is pointing to roughly where the hole was. I don't know whether it was up here or over here. And this wall of the heart separates oxygenated blood from deoxygenated blood. So what was happening was those two were mixing instead of having them separated. So when I was 4 years old, I was brought into surgery at St. Francis Hospital on Long Island is that Mineola? I think it's Mineola. They repaired the hole there, and what I didn't realize until yesterday, so I met with a surgeon yesterday, and my mom quickly said something while I was processing something else, and I don't remember exactly what she said. There was something that happened around the aorta-ish. I don't know what it was. They tacked a piece of skin, or not skin, but a piece of muscle or something that was in the way. I don't know what it was. I don't remember what was said. So I need to get more clarification on that. But I don't think either of those things have anything to do with what's going on now. So this is what happened when I was 4. It was repaired. Apparently one of the stitches near the aorta that they did to kind of whatever this little flappy thing was, apparently one of those stitches let go, but it wasn't enough for them to really worry about it or be concerned with it. So I've been living with that forever. So here's what's going on now. So August 1st of this year, I regularly get checkups. More recently, I'm getting CT scans. It used to just be echocardiograms and EKGs. They have now since added CT scans to this. I had a CT scan 2 years ago that revealed an aneurysm, which we'll talk about in a little bit. And the other issue is that my aortic valve is not closing at all. So the aorta is the valve that, or the artery that takes blood from the heart to the rest of the body. So as you can see here, a healthy aortic valve is typically a trifold design. These are 3 little flaps. There is a bicuspid aortic valve. I honestly don't know which one I have. I'm sure the surgeon told me yesterday, and it was not one of the important things that stuck in my head. But so typically, what happens is when blood gets pumped up through the heart, the valve will open up kind of like this, and then once the heart relaxes, the valve closes to prevent backflow of the blood that the heart has just pumped out. The problem that I have is I have some calcification on one of the walls of the aortic valve. So they're thinking that because of that, it's not flexible enough to close. So it just kind of stays open all the time, which means that my heart is pumping blood, and some of that blood is coming back down instead of going straight out and then not being able to come back in. So that's kind of what they're showing here, is that the aortic valve can remain open. Sometimes it remains closed or doesn't open enough. So my issue is that the aortic valve is open too much and not closing, which because the human body does what it does, it adapts. The heart has realized this, and it has started pumping harder and more blood through the aorta, which has caused an aneurysm. So if you look on the left-hand side here, this is what a typical aorta would look like. This is where the aortic valve is. So what I have is something like this. Because of all the pressure of the blood that's pushing up through the aorta to try and get the blood to stay up, it is now dilated and expanded that aorta. The problem is if it gets too big, it could rupture or dissect. So so my issue is kind of twofold, and they kind of both feed into each other. So so that's where we're at the moment. So the procedure to fix all of this is open heart surgery. In previous videos, I mentioned a TAVR procedure, TAVR, which stands for transcatheter aortic valve replacement. And what they do is they go in through the groin, up through the femoral artery, into the heart, and they put a valve inside the aorta, and they blow it up. And that will then fill the whole of the aorta and replace the valve at the same time, essentially. The problem with that, in my case, is that only works if the valve isn't opening completely. The problem is because my valve stays open all the time. When they go and they put that in, if they blow it up, nothing's going to happen. The old valve is supposed to hold it in place, essentially, but because mine is always open, it's not going to do anything. So I am not a candidate for that TAVR procedure. So my only option is open heart surgery. Also, because of the aneurysm that's there, and because it's growing in size to a size that is becoming dangerous, it's not in the dangerous realm yet, but it is getting there. So 5 centimeters or more is typically the danger zone. I'm at 4.8 centimeters. So the once we hit 5 centimeters, it becomes much more dangerous. So what they're going to do is they're going to either replace and or reinforce the aorta and shrink it down a little bit. So the next picture is just kind of talking about that. So they'll actually wrap the aorta with a bovine piece of whatever, and that will then fix that problem. While they're in there, they're going to do an aortic valve replacement as well. And I have a choice. I have a choice of doing a mechanical valve, which is good, or a tissue valve, which is good as well. The issue between the two of them is this: the natural valve is on the newer side of the technology, and there's studies that show. So they've been around since around early 2000s, from what I understand. So they're seeing lifespans of about 12 to 15 years, which means that in 12 to 15 years, I might be going through this again, if I chose the natural valve. I guess the advantage is that it's a natural valve, and it's, I guess because it's tissue, and there is less, I don't want to say rejection, but less, I don't know, it fits in the body better, I guess, and kind of I don't know. I think it's also a little bit more, I don't want to say structurally sound, but the doctor did mention that, like, this will limit me. Like, he's like, you can't play rugby or football anymore. Like, I don't play that anyways, but he's concerned about me getting hit in the chest with a mechanical valve. So so that would be out for me, which I don't really care. That's not something I've ever done anyway. So whatever, it's not a big deal. So the mechanical valve will last forever, essentially, and probably outlast me, which is great. So we're going to go with the mechanical valve because of that. So this is all one procedure, all open heart. The full procedure is supposed to take about 6 hours. I guess we can stay big screen for this while we talk about this. The full procedure is about 6 hours to do the valve replacement and this aortic root replacement as well. So that's kind of where we're at the moment. And of course, because once I receive this aortic valve, I mean, that's obvious that I'll essentially be Iron Man. So that's pretty cool. But yeah, so there's no timeline for surgery yet. I have a couple more tests that I need to get done before all of this happens. And then we can then schedule the test. And I'll be perfectly honest with you, I am actually going to meet with another cardiologist. Not that I don't trust the people that I've seen, but it wouldn't hurt to talk to someone else and get other opinions about it, and just to see what's going on. So that's happening at the end of the month. While I'm waiting for that appointment, I'll be getting ready for the surgery, doing these other tests, so that if I switch surgeons for whatever reason, I'll have everything done and ready to go. But it looks like this surgery is going to happen before the end of the year, would be my guess. I don't know that for sure, but that's kind of the way it's looking. He did say that this is not something that has to happen tomorrow. It's not something that has to happen next week, but we don't want to put it off too soon, too far in advance. So we'll see what happens. That is all I know so far. And again, like I said, I don't mean to just throw a video at you just to, push you away. It's just easier to do this, and that way you have all the information and you can have questions, and I will answer every question that I possibly can that you send me. So in the comments below, in email, in text, whatever is fine. For those that know me well, you know that I don't do phone calls very well, but if you have text and want to chat, that's cool too. So yeah, I think that's it. If you have questions, like I said, just shoot them over my way, and I'll do my best to get an answer that's accurate. And obviously, I'm not a doctor, so this is all just kind of how I understand things, and both by talking with doctors and researching stuff. So things might not be 100% accurate, so just don't take this as doctor's advice. This is just kind of what I'm going through, and how I've seen things happen. So I think that's it. Thank you all so much for watching, and I will be in touch. Thanks so much.